Okay, we are officially live. Welcome everybody. We are really excited to have wonderful panelists here today. For those of you that are tuning in for the first time or haven't heard about SARC before, I'm just going to give you a little rundown on what SARC is, and then we're going to get into our really rich discussion today. Again, for those of you that don't know, we are the Sexual Assault Resource Center. My name is Jennifer. I am one of the education and outreach specialists. And so what we do is we offer completely free and confidential services to anyone that has been affected by sexual violence. So we offer crisis intervention, which includes a 24-hour hotline that anyone can call. It is 24 hours a day, 365 days a year. You can ask questions. You can talk about an experience. You can ask how to help your friend, how to help your family member. It's a great resource for anybody to use. We also do have individual counseling and support groups as well. We're kind of a online still for counseling. It's a little bit of a hybrid, so it just depends case by case. And we do have a wait list. So if you're interested, you can just call our hotline and get on that wait list as soon as you can. We also do education and training. So I present on different topics around sexual violence, so human trafficking, consent workshops. We do sexual violence 101, sexual harassment, and a lot of other topics as well, for the hope to prevent sexual violence one day. So let's get started. Before we do introductions and everything, I do want to say if you have any questions or comments, please go ahead and put it in the comment section. However, of course, it is not confidential. So if you do have a question or something you would like to share that you want to keep private or keep confidential, please call our hotline at 979-731-1000. And so we can get that answer for you on there. All right, so let's get started. The reason we're having this panel in May, this is the topic of the panel we're going to have, is because May is Mental Health Awareness Month. So really it's our month to highlight people's experiences with their mental health, with mental illness, what they go through, maybe some trauma that they have experienced. And so we gathered everybody here today of different expertise and different backgrounds to be able to talk about this in a way, have different perspectives, to hopefully have a really good discussion. And I'm really excited. So let's get started again. Let's have our panelists introduce themselves. We can kind of just, whoever wants to go first, talk a little bit about yourself, how you got into this work, what your expertise is, and then we'll go on from there. So whoever wants to start first can.
I can start first. So I'm Bianca. I am a youth counselor at SARC, the Sexual Assault Resource Center in Bryan. I have a master's in social work, so I am a licensed social worker, and my expertise is delivering trauma-informed therapy to youth and teens age 13 and over.
I'll follow up next. My name is Iris Cahill Casiano. I'm one of the staff psychologists at Texas A&M University's Counseling and Psychological Services. So we serve our campus community as well as some of the satellite campuses around us, like the med school, for example. And, just helping our student body navigate various mental health concerns, including trauma. And in our conversation, I'll share a little bit more about what that looks like in our space. But I'm super excited to be here today and to kind of share that perspective of, when we're working with college students who experience these kinds of events, how can we help support them?
And my name is Candice, and I am a licensed chemical dependency counselor. I work at the Brazos Valley Council on Alcohol and Substance Abuse. I work primarily with the adult population, so anyone who is over the age of 18, male or female, of course. And I work with specifically identifying and treating substance use disorders. I'm really happy to be here today and to be able to talk a little bit about this, and especially how trauma and substance use disorders really do go hand in hand.
All right, well, thank you and welcome. Again, we're so thankful for any panelist that comes on one of our panels, just volunteering your time basically to talk about this. We've had different topics each month, and so we're so thankful to have this participation and the support from community members, everybody, our staff members. Bianca's our new staff member. We're really excited to have her. So let's start our discussion. So with our first question, I really want to dive into what trauma is for those like listeners and viewers that maybe don't have a good understanding on what trauma is or what type of experiences people can have with trauma. So we're just going to do kind of an overview question here. So when an individual experiences a traumatic event, they can experience, of course, a wide range of responses. What are the different types of trauma that you see within your expertise, and what are some of the common trauma responses?
I'll kick us off. I think this is a great question for us to begin with, to kind of like defining like what trauma looks like, and also recognizing that this is going to look different for different folks, right? So I'll talk a little bit about some of the very like general types of responses that folks can have with trauma. And the asterisk to that too is, you know, not everybody will respond to what we would call a traumatic event in the same way. And not everybody who experiences a traumatic event necessarily carries that trauma with them for the rest of their life too. So like there's lots of differences across individuals, but I think some of the more common ones, just to start our conversation, is I think about like those three main types of responses. The first is if we're thinking about like maybe it's an avoidance kind of piece, avoidance or numbing. So folks that might not be feeling a lot of emotions, they might be distanced from their emotional responses. That's going to be a big one. Another big area is kind of revisiting or re-experiencing the traumatic event. So this could also look really different too. It could include like intrusive thoughts or nightmares or even flashbacks. So it can be a whole range of just basically re-experiencing that event. And then when we think about other types of trauma responses, there could be physical components to that as well. So what the person is carrying in their body in terms of what they feel physically, and the other psychological effects too. So we think about our impact on mood or anxiety. So one of the big areas there is like what we would call hyper arousal or hypervigilance. So constantly feeling like on edge, like something is going to happen, like looking for threats in your environment. So those are kind of the big ones that when I think about what trauma responses tend to look like, they fall within those general categories. And people can experience different things as well, even within those categories.
Absolutely. I guess I just want to add one of the physical effects of trauma too is individuals who turn to substances. So obviously we do see that as a primary response to trauma, is that a lot of individuals, just like Ms. Iris said, do respond differently. However, a lot of them will turn to substances, whether they use substances, misuse them, or maybe even purposely abuse substances to numb the feelings, or maybe just try to, you know, as I like to call it, maybe sweep the feelings under the rug. So we often see probably, I want to say over 90% of clients that come into our treatment facility have had some type of trauma, whether it's emotional, psychological, physical, of course, a lot of domestic violence situations such as physical and sexual assault too. So we see it on a daily basis, and we really try to get the client to recognize the importance of facing the trauma head on and not trying to put it behind them or trying to sweep it under the rug, but reaching out and talking to mental health professionals about this. Otherwise, the substance use continues, and it becomes chronic, and inevitably it becomes out of control to where it affects their mental health on a daily basis. So I see it on a daily basis. Absolutely.
So, I agree. I think with different people, it's different reactions to trauma. There are some people that will try to numb, and there's people that might turn to other things such as very anxious thoughts, or maybe overindulging in work or school, or as a distraction in order to cope. So there are many types of traumas. There's complex traumas where there's multiple things that has gone maybe wrong in a person's life that they carry. And usually there is something that they'll have to do, whether good or bad coping skills, to go to the next day or to get through life.
Yeah, I'm loving that. I'm thinking also too, like Candice, I loved how you framed it as using substance use to kind of sweep the feelings under the rug. Because I think at the end of the day, these are all forms of avoidance, right? Whether we're avoiding things that remind us of the traumatic experience, or we're intentionally using things like substance use, or like you said, Bianca, like working a lot. Like we can throw ourselves into work as a way of avoiding having to like cope and process through other things. At the heart, it's you're not getting at what happened and processing that in an effective way. And either of those tools in the long run, like I get that the substance use, it serves a function, right? Like that's definitely going to stop you from feeling some of that stuff in the short term. The avoidance by like becoming, really thrown into work, that'll work for a little while too. But your body won't take it for long, right? Like after a while, these coping strategies don't really help get at the problem, and you run out of steam fast.
Yeah, absolutely. And I think another thing, Miss Iris and Bianca and Jennifer, that comes to mind, especially when Bianca said, overindulging,
Mhm.
we see a lot of behavioral addictions as well. Some individuals will gamble, or they have addiction to sex, or maybe even an addiction to food. So we see a lot of different types of individuals come in here with different disorders. I always say that when individuals are using substances, that's really a symptom of the underlying issue. I always say the problem isn't that they're using substances, and we always take a holistic approach. We really want to evaluate the individual upon coming in for an initial screening and assessment, but looking at different life areas. What was your childhood like growing up? We ask certain questions such as, were you ever abused and even sexually abused? And sometimes these questions can seem very probing, but they're most definitely appropriate, because it's not just about treating the substance use disorder. We provide referrals many times for clients for SARC. And we have lots of men that have actually been sexually abused as well, but there's the stigma that, you don't talk about it. And just like the stigma with mental health is, well, if you've got a mental health disorder, then there's something wrong with you, and people frown upon it. So we really like to take the holistic approach and be able to identify what's really going on with this individual. When did they start abusing the substance or using the substances? When did it get out of control? And you can really kind of, fit, it's like pieces of a puzzle, and it really kind of like putting a timeline together about, okay, this is what happened. And you can identify if they're honest and open with you and tell you what exactly is or was going on in their lifetime at a certain point, to really get to the bottom of the real issue at hand, which is, a lot of 9 times out of 10 trauma.
Yeah. Bianca, I'm wondering too, like what I was thinking as Candice was talking was that we make the assumption that maybe these trauma responses, we tend to see them in adults, but in working with youth, I bet you see this happening even with kids as young as 13 or 14.
100%. It might look different, because they do not. I guess most vices aren't accessible to them because they're, under 18. But I guess the feelings are all the same. If they're overwhelmed, they might shut down. They might engage in high risk behavior.
Mhm.
It's a plethora of things, especially being young and maybe not feeling autonomous, or being in a situation where they can't escape because they're under 18. There's so much, that goes with the youth as well. And I think I love what I do because it's when we teach people, like, especially at a very young age, from 13 to 18, okay, like, these are coping skills, these are grounding skills, like validating their feelings. It does a whole lot in the future when they are, much, much older.
I think you had the most amazing responses, more than I could ever ever wish for. And it was interesting, Bianca, you mentioned that one of the responses was throwing yourself into work or throwing yourself into something that on the outside looks very positive and is rewarded by a lot of people. And so in a way, it's really hiding, how someone is feeling. If someone's working out excessively, they get a lot of compliments on the way they look, how healthy they are. Even if some of those tendencies are a little unhealthy with how much they are doing it.
Right.
And they also, with work, like, wow, you're getting all these promotions, you're putting in 60 hours a week. That's so amazing. You're really throwing yourself into your work, but it's covering something up, which I think is interesting on how other people see it. And we did get a question in here actually that I would like to address now, just because it's relevant to what we're talking about. Someone in the comments said, could you all address hyper independence as a response to trauma?
I can kick us off. When I think of hyper independence, the first thing that comes to my mind is I don't need anyone. I am in control. I can take care of myself. And that stems out of this desire to maybe, like, when we experience a traumatic event, that often highlights that there's so many things in life that we don't have control over. That's part of how the trauma really stays with us. And we'll unpack that a little bit more later, I think. But this idea of suddenly like being really independent, not needing anyone, keeping everyone at a distance, that's protective in a lot of ways. It's about trying to regain a sense of control, or maybe trying to prevent future hurt from happening. Unfortunately, it's, again, you can take these things to these extremes where now you're isolating yourself from others. That doesn't work well, because we are social organisms. We need community, we need each other, and you're pulling yourself away from others. And the truth is, we can't do it all by ourselves. Like, at some point, we're going to need somebody to help us, to support us. But when we're building these walls around us, we are severing potential ties to people and resources that can help build us up. And I think that's where a lot of the harm can come from, being really like hyper independent, as the person said.
Yeah. I totally agree with Iris. I think that because we're human beings and we crave connection, we are meant for connection. It can be definitely a symptom of trauma, trying to be hyper independent, probably maybe some kind of trauma from the past where you did rely on someone and they hurt you. So you're like, I don't want that to happen ever again. So I'm never trusting anybody. And as human beings, we're not set up that way. We thrive on connection. We're here to connect. And when we're not connecting, then that's when we usually, or when there's a lack of connection, that's when we usually engage in substance abuse or overindulgence, or in all that, trying to fill those voids, because there are voids because we're not connecting.
I love that. I'm still like resonating with the craving connection piece, because we are hardwired that way, right? As human beings, that social connection is so important. So I'm over here feeling it, Bianca.
Yes, thank you guys for answering that question. I'll keep an eye on it if there's any of the other ones that are relevant, and I'll just throw them in there when we can. So moving on, we kind of mentioned some of this, but we didn't really put a name to it. So this is something that I have been passionate about in my studies, my personal studies outside of work. So I definitely wanted to touch on this too, because it's relevant to trauma and how you respond to it and development and all of these things. So we're going to be talking about adverse childhood experiences, also known as ACEs. So they can affect one's emotional and physical health in adulthood. So what are ACEs and how can they affect an individual? It's a two-part question. Are there steps that clients can take to combat some of the outcomes of having a high ACE score? So kind of just give an overview, and then maybe say, how they affect the individual, and then how can clients combat, these outcomes that people are saying, well, this is going to happen because you've experienced this. So how can they combat that if they know that they have a high ACE score?
I can go first if yeah. So ACEs is a tool that's used to figure out like exactly like the trauma that a child has, experienced, and it's an important tool. But I think what's even more important is, okay, let's say you test a child and they have an ACE score, then what? I think is the is the true question to that. I would say I'm a big believer in counseling support groups. Usually when children or like teens, whatever, are going through or have had a traumatic experience, they need time to process and build internal safety. And that's usually done through counseling and through support groups. Counseling to process their own emotions, and then support groups to feel a sense of community. That's going back to the craving connection part. If they feel like maybe they're not the only ones that are dealing with, maybe doubts or fears or traumatic experiences, it does give them a sense of community, a sense of, okay, I'm not alone, I can do this, a sense of dependent on another person, be it a friend or a support partner or whatever the situation might be, and also their counselor or their therapist. I think that really goes a long way in restoring some, I guess, some faith in humanity, because they get to build better relationships with other people.
Totally echo everything that Bianca was saying. When I think about like adverse childhood experiences, I know that there tend, I think within that scale, there's like 10 different types of experiences that are classified as adverse in that stage of development. And a lot of the main categories are like experiencing abuse or neglect. There's substance use in the family. Maybe they've witnessed a suicide or a loss of a parent. So things of that nature that folks experience early on in their development, right? And I don't remember the age range for ACEs, like when we're looking at that range in childhood, it's like something like 0 to 9 years. So really in like a very important developmental period. The shocking numbers, like I know the CDC has said something like 61% of adults will say that they identify experiencing at least one adverse childhood experience. So it's quite common, right? And what the research might suggest to you is that the more of these experiences that you have, the higher the association with undesirable outcomes in adulthood, right? So we see a lot of associations with poor health, and like literally things like chronic health conditions, chronic pain, fatigue, physical symptoms that can come up, as well as some of the other more like psychological or social concerns. So like maybe instability in work relationships and personal relationships, things like that. Now, that being said, just because we have those experiences in childhood, it doesn't have to define who we are moving forward. And I think that's the one piece that I like our listeners to really sit with. It's you can have those adverse experiences and it doesn't have to define you. You can move past it in the ways that Bianca was suggesting. We can use counseling to process these things. We can build positive coping experiences with the goal of shifting our relationship to what happened in the past. Not that it goes away or that it didn't happen, but it again doesn't have to define us anymore. So I really connect with that. And I highlight too, like the literature will also talk about things like how resilience factors into this too. And sometimes we neglect the fact that, when we have these really adverse experiences growing up, it can have a negative impact on us, but it can also help foster that resilience and strength because people survive this, right? And they move forward in the here and the now. And that's an opportunity to grow and draw from that strength, from that resilience. So I would like folks to kind of, come away with that too. Like just because you have those experiences, you don't have to be defined by them.
Yeah, and I guess I would just like to add, I think one of the biggest maybe emotional responses I see here at BB Casa is, a lot of grief and shame that's associated with trauma in particular, because we have to look at trauma as maybe even someone losing a loved one or something, experiencing the loss and the grief. or just making maybe poor decisions, or maybe making poor choices that have continually affected this individual. And so, in seeing a lot of grief and shame as an emotional response for a lot of clients, we really try to teach them to open up about their feelings. I think that's probably one of the most important elements in counseling, so to speak, in any type of counseling, is not only building rapport with your clients, getting them to trust you, and of course, earning their trust, and showing a level of trust towards them as well, and that you care and sympathize with them. I have seen so many clients open up, even in just a short amount of time, because really what we have here at BB Casa is something we call short-term therapy. 3 to 4 months of counseling really isn't that long if you think about the circumstances that are attached to it for each individual. And of course, they're all individualized on every level because everybody has different circumstances. There's no one person that comes into this treatment center that has the exact same situation. So it is abundant, and as widely ranged as trauma is, the emotional responses are different. But if we're able to recognize a lot of those patterns and those emotional responses, then we're more apt to be able to help these individuals and to provide them with the appropriate referrals that they're needing, and to be able to really feel comfortable in processing their feelings and their emotions without feeling guilty about it or feeling like somebody's going to blame them for it. So it really is a self-rewarding career field, I think, that maybe we're all engaged in. At the end of the day, it's a good feeling.
Absolutely. I'm resonating with that too. Like, how many of the clients that we serve come in with those feelings of guilt and shame, as if this is something that they could prevent it, or taking that blame on themselves as if it's something that they did. And I think about that in the context too of like how many systemic factors are at play here too that the individuals have no control over, especially as kids. So you think about like systemic injustice on social levels, right? You think about the way systems are set up to not support families, that can be so hard, and then it gets internalized as if it's something that could have been prevented, or that they could have had some agency or control over when they were kids, or in this young stage of their life. And we get to kind of shed some light on that, and correct some of that thinking, in the sense that, like, no, this isn't you. Like, this is not something that you have to carry on for yourself. There are all these other factors outside that are at play too.
Definitely, Iris, and that was actually a great segue into our next discussion question here, because I agree completely. They don't have the control of, if they're working with different government agencies that might not be organized in a way to help them and their family. So it can be difficult, and I completely agree with that. That it's really a great segue into this question. So what can the intersection of culture and mental health look like for some individuals? So it's mental health, but also interactions with different agencies and different people who are there to help them too, and if they're asking for help in mental health, but also talking about their culture and how mental health is different in different cultures too. So
yeah, and different identities too, the intersecting identities that we hold and how that plays in. Candice, earlier you mentioned like stigma around mental health, and I was like, that's a big cultural factor too.
It is.
Mhm. So I think about like, okay, what messages are we communicating in our culture around mental health awareness, around help seeking, around like improving our mental wellness? And if we're not communicating healthy, supportive messages around that, it's going to have a huge impact on whether or not people engage in that.
Yeah. 100%. The stigma surrounding mental health, I would say, probably has gotten better, like from 40, of course, 40 years, 30 years ago. But there is still a huge stigma, definitely culturally, where it's so easy to say, oh, I'm going to go get my car fixed. But it's like, how many people would be like, oh, I'm going to go to like my counseling appointment, or I'm going to go to this substance abuse clinic, or whatever the situation might be. It's not normalized in society at at this point. And I think that that's why conversations like this are super important, because it validates people's experiences and it normalizes that, you know, we all go through things that maybe we can't go through alone. Maybe we need help processing. Maybe we need support, a better support system to depend on. When it comes to the intersection of culture and mental health, I think it goes hand in hand. 100%. We see it all the time on TV where, you know, people are portrayed, people with mental health illnesses are portrayed as dangerous, or you know, you shouldn't trust them, or the list goes on and on. So if there's going to be like a 13-year-old that, you know, might be anxious or might, you know, be having depressive thoughts, maybe they think, okay, if I tell my mom, tell my dad, whoever, they might think, you know, I'm dangerous. Or so it's very layered, but also conversations like this are what's necessary to help with that stigma and to normalize that, you know, mental health is important. It is a thing, and we can talk openly about it.
Absolutely. I just wanted to add, Bianca and Iris, you know, it's that uncomfortable conversation sometimes that I often have with my clients coming in, and especially depending on their, you know, ethnic background, or whatever their cultural upbringing may have been. And I try to have my best to, you know, to validate that, and of course to respect those cultural barriers. However, I also want people coming into treatment to be open-minded and to be aware that it's okay to talk about things that are going on. I educate quite often, you know, in group sessions on covert relationships, which is, you know, the secret relationships in families. And we talk a lot about family dysfunctions as well here in treatments. With covert relationships, individuals in the home know exactly what's going on. They may know, hey, dad or mom is an alcoholic, or we know that sister, you know, is 16 and she's using drugs, but nobody's talking about it. So nothing is being done. And, you know, and that's how some individuals are raised, is that you don't talk about the things that hurt us the most. And I think the exact opposite needs to start happening, is that we need to start talking about these things, and especially with our children at an early age, because this is really where the values and the morals and, you know, we're setting our children up, you know, to have a hopeful future, you know, a bright future. And so with substance use disorders being one of the most common emotional responses to trauma, we really have to be able to sometimes even roll with resistance when it comes to clients, because sometimes it's like fighting back, and they push away, and you can just tell that they've been either, you know, they've been molded to think or speak a certain way, or they don't know how to verbally express themselves, and sometimes even non-verbally. You know, they say that we communicate more so non-verbally than verbally. So I definitely see that, you know, people's cultural upbringing does have a huge impact on whether what they choose to discuss, and maybe what they choose not to. So that's one thing I really do try to work on as a counselor on a daily basis with my clients, is, you know, to let them know that it's okay to talk about things that make you feel uncomfortable. That's important for everybody to know.
Absolutely. I'm over here like nodding, like my head's gonna fall off. I'm also thinking too, like, because we're talking about culture, and we can dive into some of this a little more deeply. Like I identify as a member of the Latinx community, and there's still not I'm painting a little bit generally here, but even within the Latinx community, there's still this pretty heavy stigma around mental health, as if it's something that's in your head. It's not the same as a physical injury. It's, you know, all of these things that are stigmatizing and that can sometimes get in the way of folks within the Latinx community from reaching out and getting help. And so it is that delicate balance of trying to validate, like, yes, okay, this is where you're coming from culturally, like I get it. And also, how can we figure out a way to help you with this? And just speaking to like how trauma can manifest differently because of our cultural values and cultural differences, you know, in the Latinx community, not uncommon for a lot of the more physical symptoms to appear, right? Like feeling fatigued, the chronic pain, the GI distress, a lot of those like body symptoms, because that's easier to talk about. That's okay to talk about. That's a physical thing that's real. It's not just, you know, in our head. Um, and so like that can often be what presents itself as the primary concern when we're talking about trauma, but it's still trauma underneath the surface. But we have to be able to engage in those dialogues. And Bianca, like you were saying, normalizing this, saying it's okay. We're not going to judge. We're not going to like hold this against you or see this as a weakness in you. Instead, it's a strength that you're coming to get help, to try to figure out how to get better and live life the way that you deserve to, with, you know, happiness and success in all these different ways. So I resonate with this, and I'm so glad we're talking about that intersection of culture and trauma and what that looks like in mental health.
Yeah, and I think it's so important, yeah, for us to be talking about this, for, you know, people who want to learn about other cultures that they don't really know about and that maybe are in this field that, I mean, I would just push more education, 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 try to learn about cultures that you have never grown up around. Because you may encounter someone one day that has that culture and is using it in a positive way to help them heal from their trauma, like of the family support or anything of that, that where they're using it in a way that may be different than how you would tell them to heal, and the different coping skills you would give. And so it's I always think it's so important to learn about so many different cultures and try to be aware of people that are different than you. That's why I've always tried to push that as much for myself personally and for others too, just to, you know, just educate as much as possible, because there are some beautiful, beautiful cultures out there and such great things in each one. And so it's always just important to know about them and to use that in the field that anybody would work in, regardless of what it is. If they work in a corporate job anywhere, you can use that as a tool to connect, really.
Right.
Any other last comments on this question before we move on?
I have a last comment. I think what you said was super important. Being culturally competent and understanding that trauma might look different for very many people. I think that that's also probably the most important thing to note, because as Iris mentioned, a person can walk through our doors and say, "Oh, like my stomach is hurting, and I feel fatigue, or I always have headaches." And maybe they might be trying to communicate that, hey, like I might be stressed, I might be anxious, but maybe they have been conditioned, as Candice was saying, to not talk about like mental health, maybe presented in a more socially acceptable form, like medical attention or whatever the situation might be. But usually when a person walks through our doors, it already shows some sort of strength, and they're there, so we have to meet them where they're at, and knowing that this might present itself in many different ways for many people, different backgrounds, is also super important to meet them where they're at. So yeah, that's just what I wanted to comment.
Okay, we did get one more question as well. Someone in the comments said, so what are your thoughts on comorbid diagnosis? So for example, having a pre-existing mental health condition and then experiencing some kind of trauma. How do you suggest treating the impact of trauma can have on other mental illnesses like depression, anxiety, or bipolar disorder?
That's can be a challenging question to answer. I think when we think about this, and I'd be curious to hear Candice and Bianca what you both think about this too. When we talk about like the whole purpose of diagnosis is really just to get at what is happening and how can we help. At the core, that's what it is. It guides our treatment planning and things like that. So no matter when we're talking about comorbidity, if folks, for example, some of the common ones, right, you'll see things like PTSD often be comorbid with stuff like anxiety and depression. Those are the big ones.
Right.
you have to decide, and this is through working with your counselor and really diving into and exploring what this experience is like for you, what is really at the heart of the problem, because it can be the trauma that then informs the depression, right? Which makes a lot of sense, because if you're carrying this trauma with you and you're experiencing a lot of those symptoms oftentimes for years, right? In many cases, when we're talking about like a PTSD that has lasted for a while, that could be a long time. Of course, that's going to impact your mood and your relationship with others, yourself, and the world around you. So maybe in that sense, it makes sense to treat the trauma first, and then you'll start to see relief in these other areas. So there's no one size fits all answer to that. It's really figuring out, okay, for you, what is the most salient thing that is interfering with your day to day? And then
Right.
how do we help you with that first? And then that's usually when we can start to tease apart, okay, yeah, this is the trauma, or, maybe it's, we really have to get the bipolar presentation under control before we then tackle some of this other stuff.
And yes, I 100% agree. That's a great point that you made, is that usually we should go for, or like start treating the things that are affecting our day to day. So diagnoses are saying, okay, this is what's happening, and then we create like a treatment plan around it. So with the, I guess, not focusing on, okay, maybe this should be more important than this. It should be, okay, which one is really interacting with my day to day life? What is really affecting me generally overall? And then starting from there. So, yeah, that is a tricky one, and it's something that I'm still learning to navigate. But that was a great question.
Yeah. Candice, I'm curious on your thoughts too, because when substance use is in the picture, especially when it's gotten to the point where it's escalated to substance use disorder, I feel like that can oftentimes be the place where we need to start, because that can be so prevalent in what they're experiencing in their day to day, or in terms of their interference of their functioning.
Absolutely. And so many times it is hard to differentiate whether or not it's maybe the mental health disorder that comes first, or if it's a substance use disorder. One thing my director of treatment, Ms. Cindy Soltis, um, taught me a couple years ago is that it's so important to treat the substance use disorder and to also equally treat the mental health disorder as well. Because if you only treat one of them, let's say an individual comes in and they want to stop using substances. Okay, that's great. But if you're not going to manage your mental health, you're only treating half a person. And that's really kind of how we look at it. So, I also like to really, think about, it's really hard to, I think, differentiate, like I said, which one comes first, right? There's so many different elements that you have to consider in a person's life. Did somebody serve in World War II or something? Was there prior trauma? Are there any different are there types of, physiological effects that you have to take into consideration? Because physiologically speaking, if somebody isn't doing so well on the outside, then it can start to affect them internally, vice versa. And so there's so many, I think that's why scientists are still continuing to study, the human brain. And, I think the human brain is such an interesting tool that's going to be studied for decades and decades to come, probably even when our children are older, because there's just not really one set of answers. The human brain is so complex and it's so interesting too. And we're all built differently. We all have a different genetic makeup. And so there is a lot of genetic predisposition too that I want to, briefly include in there when it comes to individuals with mental health disorders and substance use disorders, is that, mom or dad or grandmother had some type of disorder too. So there's a prevalence of that as well.
Right.
Yeah. One last thought I was thinking as we were talking to, like in terms of trying to figure out what do you tackle first. And maybe this is because of the population that I tend to work with, college students. So it makes sense that if it's a trauma response that's interfering with our ability to focus and pay attention to things, oftentimes the first thing students will think of is it must be ADHD. So, and they'll try to get that treated, and it masquerades as ADHD really well. Like trauma can be really sneaky. It can look like lots of different things. It can look like ADHD. And one of the signs, one of the first clues for me, like when I'm working with someone and they're like, this just isn't working. Like I've been, taking my medication, I've been following my doctor's recommendation, and I'm still having trouble focusing and doing things, then it's like that's a good clue that that might not be what's really going on, that we have to go deeper. And we can use that information to kind of help fine tune, like, all right, the attention isn't because you have ADHD, it's because it's trauma, it's this other bigger thing, and then we can start treating that more effectively.
Yeah.
Absolutely. See, I'm just over here because so my side of things is, education. I talk about sexual violence. So it is so interesting to hear, all different types of traumas and how that shows in different types of individuals too. So I'm over here. I'm learning more than you guys think, probably. That's why I was so excited to do this panel for me personally, just so I can, learn and hear from the experts that are here and willing to talk about this. And so the next question here is somewhat similar, talking about multiple mental illnesses on top, or experiencing multiple types of trauma at once too. Do you think that the trauma of the pandemic and the issue of racial injustice in the past year has layered on existing personal trauma that individuals were dealing with prior to those events? And how so? How has that affected it? See, everyone's like, yes. See, even this one is like, everybody knows this has been an issue for anybody, for survivors, for clients, for anybody that has already previously experienced trauma. It's like all one on top of the other.
Yes, I guess. 2020 was.
We've definitely seen a lot of, I'm sorry, Bianca, I didn't mean to cut you off.
Oh, did you want to go ahead, or do you want me to go ahead?
No, ma'am, I'm going to let you go first.
So yes, I think that's like the simple answer. Yes, the pandemic and the issue of racial injustice that happened, that is, happening and happened in 2020. Definitely layered our maybe pre-existing trauma. As I mentioned before, we are social human beings, and we do crave connection. So when the pandemic hits and it's like, okay, everyone stay at home, and there's so much loss. There's loss of lives. There's loss of opportunities. There's loss of social engagements, and there's loss of activities that might make us happy, or that we might have used to cope, and all that. I think it was a year that there was so much loss, and if we have experienced trauma in the past, it's definitely a layered response, because there is no connection. And then there's that added trauma of losing, so of grief. There was so much death and so much fear. So that's also another angle where it can definitely layer upon the trauma that we've probably already experienced. And also with racial injustice, with like seeing human beings treated a certain way, or maybe feeling, that you maybe don't belong, or that, you're not wanted here, or whatever the situation might be, it can trigger like a trauma response. So those two things alone is, it's a lot of complex trauma. I do think, and I'll be curious to see what you guys say about this, but I do think that there is going to, and I've seen, a general shift in people talking about mental health, because last year there was, I think, our coping skills or our distractions were taken away from us. We weren't allowed to go party. We weren't allowed to do these things that we would normally do and not like sit by ourselves and all that. So it's a lot, but I'm hoping that it really does, I guess, force us in the right direction towards talking about mental health and towards talking about seeking help and seeking support when we feel overwhelmed, or when we realize that we have had traumatic experiences and we need help.
I'll add a little bit from kind of a neurophysiological perspective too, because I think this is important to talk about in the context of trauma as well. When we have a trauma response, it's actually quite a very physical as well as psychological thing, right? Our mind and our bodies are intertwined, and trauma is a really good example of how that works. So when we experience a traumatic event, right, that's going to activate usually like our fight or flight system, because we're responding to a perceived threat in the environment. So our amygdala sends all of those wonderful hormones into us, like our adrenaline and cortisol, our stress hormones that activate these physiological responses to somehow react or respond to what's happening to us. And because humans, just as organisms, we want to try to protect ourselves moving forward. We learn that really fast and we learn it really well. And that's why we carry these trauma responses with us, because we're still kind of in some ways reacting to whatever that event was, because it impacted us so deeply. And we had all of those physiological as well as psychological reactions to it. So that's the framework for this. Now, imagine you're in 2020, which was one thing after another. So you're experiencing one traumatic experience after another. Your whole fight or flight, your stress response system is pretty much continuously activated throughout 2020, right? So with all of the things that Bianca was sharing with us, yeah, we were all responding to that. I don't know if I haven't met anybody who wasn't in some way like this throughout 2020, right?
I agree.
Right. So what that basically means is physiologically, we've been experiencing toxic stress. Those hormones have been in our systems, maybe almost constantly, right? Or quite frequently, chronically over that past year. So our bodies are going to have a response to that. Our brains are going to have a response to that. So this just speaking from that, I want to say that to normalize it too, like going back to this idea that when we talk about mental health stuff as if it's just in your head, like it's made up, it's not real. It's like, no, it's quite real, and it's your mind and it's your body, and this is how your body's responding to it. So now how do you take care of yourself to recover from that? So this is just to like add a little bit of that information, so for folks who are wondering like, oh man, was it me? No, it was a very stressful year and your body was responding to that and your brain was responding to that. Now, how can you start to recover? How can you start taking care of yourself as things slowly get back to business as usual-ish?
Absolutely. I would just add to Bianca and Iris, we saw an immense, I don't even know how to describe it. We had a severe increase in substance use disorders in the past year. We had a waiting list, so it was stressful for us as counselors, wanting to get people in, and then the inpatient facilities having waiting lists. So here we are, we have people who are a high priority population and they're needing a bed like yesterday, and they're on a waiting list for up to a month or so. So rather than going to an inpatient facility or being able to come to our intensive outpatient treatment program, we're doing our best to facilitate via Zoom and even over the telephone to meet their needs. But it's really difficult to try to establish that connection with somebody when there's no direct contact. And so I felt really disconnected for a long time, I think. So hopefully things are starting to get more normalized, of course. But I loved your perception, Iris, that you just stated earlier, and Bianca, like you had stated, a lot of individuals pretty much being isolated and not being able to navigate on their regular routines definitely puts a damper on people's, normal lives, so to speak. So it's definitely been a difficult process. but I think it is important for people to know that we do have the services there. If any individuals are looking, to reach out, whether it's for mental health or, for substance use disorders, to reach out to BB Casa, because we are now open 24/7. And of course, we'd love to meet with anybody who needs assistance with any type of substance use disorder.
Yes, Candice. I mean, at SARC, we have definitely been experiencing a very, very long wait list that we haven't experienced since I've been here. I know before pre-pandemic, we did have a pretty normal, maybe shorter wait list. Sometimes we didn't have a wait list at all, but it has really grown this past year, and we've hired new counselors, and we're trying to meet the needs of the community, but the needs are so high because there is just so much need for mental health services in this area, especially mental health services that are free. Because that is, again, another barrier to mental health. If somebody can't afford to, seek counseling, or they can't afford to do this or that, it's going to be even more difficult for them to heal and, find the coping skills that they need, work through the trauma they've experienced. So it's like a call to everyone. We need more mental health services, please. I think it's so important, and it affects all areas of life. It affects how people work. It affects relationships. It affects crime. It affects every really thing we look at. So in my head, of course, maybe I'm biased because of the work, that everybody is in here, but it's probably something that could fix and solve a lot of issues that are, really in our community, in our society, especially when we're talking about adverse childhood experiences. We're talking about all of this, trying to prevent it as much as possible. So we aren't, dealing with the long wait lists, that hopefully we don't need the long wait lists anymore, and we can help who needs it, and it's not as many as we have. But I appreciate you guys sharing all of that and talking about this pandemic. I mean, I think all of us can agree, even the people who are working in this field saw effects of everybody has seen effects of this pandemic, and everything that happened last year. Everyone dealt with it differently. When we're talking about responses, everyone had different responses. They found new coping skills. I tried to find hobbies that I didn't know I would like, and it was interesting for sure. I picked up knitting for a while, which I don't know why. It was kind of therapeutic. It was nice. That one fell out real quick. So, on the topic of counseling and seeking help in that, what would you say to viewers who may be nervous or unsure about seeking counseling? And how can the counseling process look for an individual within your agency?
Okay. For SARC, we have a hotline, as you mentioned previously. So usually individuals would have to call. There is a wait list, but the counselors, my fellow counselors, are working hard to make sure that we get to everyone and as fast as we possibly could. For viewers that are feeling unsure or nervous about counseling, I always tell people that for the most part it is a safe space. View it as more so support, I would say, than walking into an office and you're like, okay, this is what you need, or that's not what you need. That's not what counseling is. We're literally there to facilitate healing and to support people, because everyone, I believe, has it in them already to facilitate healing and to live their best lives, so to say. So I think thinking about that from more holistic approach and, a chill approach is more helpful. Usually I think the hardest part is like picking up the phone, calling, and like walking into the office. I haven't met anyone yet personally that has said, oh, I wish I never had therapy. So that has to be a good sign, but yeah.
I'll add that like Bianca says, it's that first step, like making that phone call or taking those first steps that can often be the hardest one. And what I try to say to folks is like, I'll normalize it. Like if it's your first time going to counseling, yeah, it might feel a little weird because it is a little weird. You're about to go and talk to a total stranger about these really intimate things. But that's okay. Like, and it's okay to meet folks where they're at and let them know like this is different and it's going to be a different kind of relationship. This is a therapeutic relationship that's built on a lot of trust. Like this is a confidential space, you know, with a few limitations, like whatever you say is going to be kept in confidence in that. Um, and then the other thing that I'll often see with folks that are hesitant about counseling is feeling like, oh, what if I don't really need this? What if somebody else, you know, needs it more than I do and I'm taking that space away? And I try to encourage folks to not minimize what they're experiencing, right? That's so unfair to you as a person. Like if you are doing that to yourself, like anybody who's listening, if you're telling yourself like, you know, maybe I don't have it that bad, you know, there's somebody else that could use it more. Don't do that to yourself. Like it's okay. You deserve to feel better. You deserve to get help to take those first steps and at least like see what it's like. I often tell folks like dip your toe into counseling. It doesn't have to be a lifetime commitment. You're just trying it for a little while to see what that feels like. And then, you know, then you can decide what happens next. So those are some of the things that I'll share with folks who are thinking about getting into counseling. And then in terms of like what we do over at CAPS, we serve the Texas A&M University student body. I will say similar to what y'all do at BB Casa is we work under that short-term model. At CAPS, what that looks like is maybe about 8 to 10 sessions over a calendar year. So it can be quite brief. So for students who are thinking about, you know, reaching out to us, we're a great first place because it's convenient. We're here on campus. We offer hybrid right now. We're doing telehealth. We'll be transitioning to in-person over the summer. So you get to decide what works best for you. And, you know, it's already included in your student fees. So if you want to try counseling, this is a great first step. And again, it's low commitment, right? We're talking only, you know, a relatively few number of sessions for you to try. You can build some good coping skills. We can really help you get connected with, you know, what your experiences are and where you would like to go next. So really, really recommend that. Great place to get started. If you're not sure where to go and you're a TAMU student, come and see us.
Great, and I'll go ahead and add BB Casa, of course. So one good thing about our program is that we are offering telehealth or Zoom sessions for individuals who maybe live out of county. Maybe you just can't find a babysitter and you have 3 or 4 children at home. And so we definitely like to, you know, take that into consideration. We want you to know that this is a safe place where you can openly talk about things that are, you know, some of your most intimate details, as Iris said. It's not easy to come in and try to normalize counseling when this is your first time doing it. So I always try my best to be relatable to clients and really try to understand where they're coming from. I really try to live by the concept. Not only do unto others as you would have done unto you, but, you know, walk a mile in your shoes,
Mm-hmm.
right? If the shoe were on the other foot. So being able to just really build that connection and that relationship with your clients. And I know it can be so difficult to maybe pick up the phone or walk into the agency if you've never done this before, and especially if you feel like you don't have such a big support network in place and you just feel immobilized. This is your first step. You know, reach out to somebody, whether it's picking up the phone and calling our receptionist. We can schedule your initial screening. As far as over the telephone, we do prefer direct contact when it comes to the first initial screening because there's you know, a lot of paperwork that does need to be done. However, we do our best to work with you and we do want to meet your needs. I live by the ethical obligation of do no harm, and so your information is safe, it's confidential, and we really are looking out for your overall wellness because that's the most important thing. So reach out to us, whether it's walking through that door during our normal business hours, which is Monday through Friday, 9 a.m. to 5 p.m., or even after hours. I'm here until 9 p.m., Monday through Thursday. or just giving us a call. So don't be afraid. I can assure you that there are like-minded individuals here at this agency, and it is a great place to connect. And it's a therapeutic environment where you can learn so much about yourself, and become live a better quality of life overall.
Yeah, that is amazing. I hope people who watch this later on or are watching this right now are taking some of that in, because it really is it's hard to take that first step and pick up the phone. So always having it's nice to have maybe somebody there to sit with you to do it. I sometimes people ask, how do I help my friend? Just sit there with them while they call, dial up the phone for them, give it to them, let them do the talking, but just be that support for them. Before we wrap up here, I've heard something, an experience, that goes around, and I've heard it from a couple different people, and I kind of want to get your thoughts on it too. I've heard, someone said, I had a really bad experience with a therapist or a counselor, so that's not for me. I don't want to do it. I don't want to be it. This person didn't make me feel good about what I was talking about. They invalidated that one person, and now I never want to do therapy again. So what would you say to that? Because I've heard that on the other side of people that I talk to in presentations and different, just people in my life too. And so I would love to hear your guys' thoughts on that before we wrap up.
Yeah. I love that you said that. I personally haven't met anyone that has said that before, but I do know that there are some people that struggle with that. And I think a lot of it has to do with that it is uncomfortable. It can be very uncomfortable, as Iris said, to walk into an office and tell a perfect stranger your deepest, darkest secrets. And vulnerability is something that can be uncomfortable, but ultimately, I do think that, if you probably tried one person and it wasn't a good fit, you can always try someone else. There are different styles. People have different communication styles, so that's also something. And as my supervisor would say, my clinical director, Debbie, things might get worse before they get better. Yeah, so I tell that to all my clients. You might drive home and think, oh my God, I can't believe I just spilled my guts out to this perfect stranger. But ultimately, usually things will get worse before they get better. But the most important thing is they do get better. So,
Yeah, I love that you said that, Bianca, because that is so true. I think people might have this idea that like therapy is like you're going to go and you're going to feel amazing day one, and hopefully we get you there, but like therapy isn't always a comfortable space, right? Like it's a safe space and your stuff is going to be confidential, but sometimes it gets tough. Like we're going to ask tough questions, we're going to dive in and dig into the stuff, but you're not alone in that digging. Somebody will be there with you. But that's so important to highlight, because I think you're right. A lot of folks might be like, "Ooh, this didn't feel good. This is not helping," and then quit before realizing like, no, it's not that the therapy doesn't feel good, it's that the stuff that you're dealing with doesn't feel good. But therapy can help you with that. The only other thing that I'll add to that too, it's thinking about when we're diving in, I have definitely heard that, where people are like, oh, therapy was awful, I'll never do that again. And Bianca, the other point that you said that really resonated with me is it's about fit, right? Like, is this a good match? Like, you want a therapist that you'll gel with their style, their communication patterns. Like, it's okay to not gel with somebody, and don't confuse that for like the therapy being wrong. It just might mean that the therapist's approach, whether it's their treatment style or them as an individual, isn't what you're looking for. And it's totally okay to like want to find a therapist that you can connect with, whether that's because you're looking for somebody who shares certain identities with you or shares certain experiences or has specific training in what you're needing. That is okay. And it's okay to find that and advocate for that for yourself.
I agree with Bianca and Miss Iris. I have heard that plenty of times before from clients. Of course, I don't. The only thing I can do is to be, a listening ear for them to be able to vent sometimes, because we always say, clients should talk 70% of the time, and we need to be listening at least the other, 30%. That's, really important. So, I do use the approach, can you give me a chance? Which has worked actually, give me just 1 or 2 weeks, come to groups, have 2 individual sessions with me. And, if we don't mesh or you feel like it's not working for you, I'll give you another referral, because we never want to just shut somebody down completely and tell them, well, this is it. This is the only way out. Because as Iris said, some people don't really mesh well together and everyone has different personalities from therapists, to clients. And so sometimes it can actually be a healthy thing for a client to maybe navigate to another therapist or something that maybe is more along the lines of someone they're going to mesh well with. And I think that's just a part of being human, that's a part of humanity is that, and the beautiful thing is that we're all different. You'll have different personalities and different characteristics. Now, I have had some clients come in and say, well, I just felt like she was judging me. And, Candice, I'm just so angry. And I say, well, you know what? I'm not here to judge you. That's one thing we don't ever want to do is we don't want to judge people because like, both of you said, they can be very vulnerable and especially dealing with trauma or just having, a rough history or a rough past. The last thing somebody wants to do is come in and feel like somebody is judging them because of something maybe they said. I do believe in confronting and being honest with my clients, but I think there's appropriate time for that as well too. And so when we take the time to actually sit and listen to what it is that they have to say, we can really kind of, learn more about them and what it is that they're needing. So I've learned that, it's definitely important to use our ears sometimes rather than our mouth when it comes to our clients. So yeah.
I'll add to for anybody listening who is thinking like, yeah, no, my last time I was in therapy was awful. I don't want to do it. just to help reassure you I would say not everybody, for the majority of folks that have come to me with those kinds of experiences where they're like, my last therapist, I'm here just to give it one last shot. It has turned out well. So if you're in that space, don't give up because it might be the next therapist that you connect with and really helps you in this journey. So I just wanted to assure folks that like having heard that can also tell you there've been some good outcomes with that. And also like I haven't been the therapist for them either for some folks too. And that's okay, because then we get them connected with other referrals and with other folks that can better like help them and get them what they're looking for and needing. And that's okay. So wherever anybody who's listening to this right now, wherever you're at in this journey, that's okay. See what happens, give it a try and know that, it could be the next shot that works really well for you.
That is amazing. I'm happy that we touched on this just because, people will say things and they have ideas about things. So it's nice to hear, some things that can, bust those myths and we can discuss those here. But we are at the end of our discussion today. We're getting to the end here. So are there any last final thoughts or any things that you guys want to, wrap up before we leave? There's no questions or anything. And so anything you guys want to add before we end our time today?
Candice, Bianca, I'm so grateful for you both that you're here serving this community and the agencies that you represent too. Like I'm really grateful that y'all are here because it's so needed, and getting to meet you today and hear how you approach things. I know our community is really lucky to have you.
Thank you. That's sweet.
Thank you, Iris. Bianca, it was wonderful to meet you. And Jennifer, I'm just so thankful that you gave me the opportunity to join you on this panel today. So thank you.
Yeah. Also, I wanted to thank Jennifer, of course, for for moderating this, and also it was such a pleasure to meet you, Iris, and Candice. I think hearing different approaches and like hearing your stories and your thoughts on things, I love to see different sides of what I do, and it's awesome that you guys are in the community and working towards this thing called life when it comes to health. And also I enjoy having conversations about this. I think it's one of my passions as well to like educate, as Jennifer does on a day-to-day, and it's super important because we're normalizing mental health, and I'm so grateful to be here.
Yes, I feel so privileged to be able to learn from everybody. Again, education is my thing. It's my favorite thing. I think it's the most important thing in this world to me. Of course, that's my opinion, but yeah, I feel very privileged to be able to listen and learn from your different perspectives and expertise. And I know that there are going to be viewers that are going to watch this, and I hope there are going to be viewers that are going to watch this and maybe think, okay, maybe it's time. Maybe it's time for me to reach out. Maybe it's time for me to reach out and get help, even if it's reaching out to a friend or reaching out to somebody and saying, hey, I listened to this panel. So that's, of course, my whole goal of being able to do these each month is to really make a difference on even one individual's life. So they feel like they might be ready to talk about what they've experienced and to start their healing journey. So that brings us to our end here. I will be putting in the comments the different organizations and websites of the individuals here today on our panel, just for anybody that wants to go to the link and ask for more information or sign up for any services they have. So I'll be putting that in the comments. They'll be up by tonight. But yeah, again, I appreciate everybody. And if you had any questions or this brought up anything, please, again, call our hotline tonight, call tomorrow. You can even DM us if it's, a general question or anything, and we'll get to that as soon as we see it. But I hope everybody has a great rest of your night, and happy Thursday. It was almost the weekend. I know everybody's probably excited for it to be here. So again, I hope everyone has a great rest of your night.
Thank you.
Bye, everyone.
Ladies.